So I just want to walk through this story, but I want you guys to talk more than me. Mitchell, what does this picture here represent? What's happening here?
Well, I think this was at the Lincoln Harris
Yeah,
event,
April of
and
2023.
which Susan came, that's my wife, Susan. And when she found out that I was finally going to start looking for an associate and that you were going to help me, she just posed for a picture by putting her hands together, saying, "Oh, thank you, Paul. Thank you so much."
and
And this has become one of my favorite pictures, and I think one of yours also.
and two of my favorite dentists, you and Todd Fleischman, sometimes people see things from outside of your box. And I said to Todd in 2017, you need an associate, you need an associate. You're doing it too much on your own. Paul, I don't need an associate. Now Todd has two associates. And he says, I wish I got one sooner, but stop bragging about yourself, Paul. And I said, I don't care. I want to be. So before we get to the next step, just tell, I mean, I think this would be so good for practice owners, and you're so authentic, Mitchell. What was stopping you? What was holding you up? Why was it your wife and a guy who calls himself Dr. Nacho, two of the people that had to say, you got to do this instead of you just doing it on your own?
uh, we all fall into like inertia. We all get into a groove of doing things a certain way. I got very accustomed. I practiced with my father for many, many years. And then when he retired, I was on my own. I was used to doing it. And there were things I didn't like about it. I didn't like not having another dentist around to talk to about stuff. You know, and I didn't like having somebody to share the load of some of the work. But it seemed like I didn't really know how to go about it. I didn't really have a process for stepping out of that until you came to me with this method of kind of putting people together. I didn't really like the other ways that people had found associates. I didn't think it was going to work for me, and I was a little scared, frankly. Perfectly honest with you, I was worried and scared about
And I really appreciate it. Just like patients at the dentist sometimes. And it doesn't mean
it.
people are foolish. It doesn't mean that they don't know what they're doing. It just means that emotion takes over that causes analysis paralysis. And just if I can kind of just help people understand that the way practice owners find jobs is usually one of three ways. You can hire a high level recruiter that usually charges $10,000 to $30,000 to recruit an associate for you, and it can be totally worth it. It's not a ripoff. There are dentists. I used to do this, Mitchell and Patrice, and a dentist would call me up and say, "Hey, my Patrice left. She moved to Napa Valley. She wants to taste wine all the time. She used to produce $60,000 a month, and I need someone, Paul." And I say, "Okay, Dr. Mitchell, I can help you. It's $10,000. I'm going to look for an associate. If I find you an associate, it's going to be $10,000." And you go, "That's a ripoff. I'm not paying you." And I just say, "Hold on a second. If you don't have an associate for 2 months, you lose $120,000 of production. So it sounds like if I find you someone, you would be happy to pay me that." And I will share with you guys on this call the happiest people to pay that 10,000 were DSOs. I did have private practice dentists that do it, but I will say that sometimes private practice dentists can suffer from what I call dentist cheap. And what that is, Dr. Mitchell and Patrice and people on the call, and that is spending $10,000 on a 10-day vacation to France, but not wanting to spend $10,000 on your business. So that's high level recruiting. There's also free, and Dentist Job Connect is an affordable platform that currently charges between $1,000 to $2,500 to help you hire an associate. So you're the practice owner, and we talked about what motivated you to hire an associate. Now, this is, I want to share something a second. The other day, Drew, and I got to get the video, she's 5. She was wearing a Jasmine costume, and she said, hey, Paul, hey, Dad, I'm really good at this. I'm really good at this. You should video it. And I thought, what happens to us? Like, why are we so embarrassed to say like what we're really good at? Why don't we ever say video us? Like she was so proud to be. So what has been your favorite part about having an associate dentist, Mitchell?
My favorite part about having an associate dentist is having an associate dentist. It's being
Oh,
having somebody else with me in the office to talk about dentistry with and to work on things with and to teach things to and frankly to learn things from also. Uh, I was missing that for the most part. You know, it's also nice to have somebody else to help share the load of the work and give me more time to do some writing. It's also, nice to have somebody else seeing some of the patients, that I don't have time to see or whatever like that. But really, it's not practicing alone anymore. To
I
be
love that.
perfectly honest with you, and there's plenty of good reasons to have an associate. Sometimes they're, business development reasons. Sometimes it's purely financial. That's my reason. I just like having somebody else around. I like working with Patrice, and I like seeing, the way she views things, the way she sees things. We work on things together. It's been a lot of fun, and I think it's hopefully it's been for her also. I think it is.
Well, we're going to ask her in a second, and I want to share that's really awesome. And I said to Dr. Mark Costas, my good friend, and I know Mark, and he's written this down because he likes this line from me. Dentistry can be a very lonely profession, even though you're surrounded by people. And it's really, you can feel that, right? So even though you're surrounded by your patients and your team, and the challenging with your team is they're not licensed to do the work that you need help with. Sometimes I say to my Kate, I go, oh, I only did one filling and you billed that two. So could you like change that from two to one? And she goes, oh, thanks, Paul. And I said, how about you go help me with my extraction now? And I go, oh, yeah, that's illegal, right? So I think for anyone on this Zoom, when you are the only licensed person to do the thing that you have to do to get through the day, it can feel very lonely and overwhelming, no matter how many amazing front desk team assistants and hygienists you have. And unless you're a dentist, it's hard to feel that. So before we get to Patrice, I'm starting a club. Here's the club: Mitchell Rubinstein, Maggie Augustin, Todd Fleischman, Tim Pruitt, Bob D. These are people who I've kind of given a kind annoying stuff. So what if you, let's say you be me, Mitchell, kindly annoy some dentist out there thinking about it who needs to hire an associate, why they should do it.
I know somebody. We talked about him already. And one of my neighbors here in New York City, we think should get an associate, right, Joe?
Yes. Yeah, he's in the process. What would you tell them? Uh, you're going to be glad you did it. Get your ad out there. Don't get yourself into analysis paralysis. What would you tell them?
I would tell them to get started and learn the process by doing it. Once you decide you want to do it, there are so many things that can weigh you down, and you can't figure them out until you actually do them. You can always modify the process once you've begun, but get started. Talk to people, go on Dentist Job Connect, talk to other people who have associates. Get the ball rolling, because that gets you out of your inertia not to do something.
Yeah. And many dentists say this, and they say this with good intentions, but it's wildly impractical. They say, like Dr. Lincoln Harris from RIPE, and you guys can put the RIPE Global Training Program in there because they're amazing sponsors. They say, Paul, when I hire an associate dentist, how do I know they're going to have an awesome personality, be great at dentistry, and be a perfect fit? I said, easy. You're never going to know. You got to test, not guess. Stop pretending you're going to know. And no one knew that about you. So I want to go to the awesome Patrice now. Now, Patrice, same question for you. What's been your favorite part about working with Dr. Mitchell Rubinstein?
I'd say one of the biggest things is just having true, almost like hands-on mentorship. He is just so excellent at teaching and really cares about my growth. So that's been the biggest thing for me, because not a lot of jobs get the opportunity to do that when you're an associate in some crazy busy PPO, patients running. You don't get time to have that kind of mentorship. So that's been really amazing.
I love that.
Feels good to hear.
And also, Patrice, tell the audience, because I'm here to help, right? And I know sometimes help is uncomfortable, but many people will say, oh, just graduate from dental school. You don't have to do a residency. Go work for a DSO and you'll get better working for them. But what I always say is, who's going to teach you there? You might just ingrain worse habits. And I mean, I'm someone, I know a lot about golf, and I've seen people play golf for 20 years and they're worse 20 years later than when they started, because no one taught them the right way. So maybe if you could kindly annoy some of your own younger dentists, why is just like getting out there working by yourself, and why does that not necessarily make you better? It might give you experience, but it's hard to get better if you don't have someone on your side.
Well, I would say, just from my experience in residency, seeing the full scope of dentistry and just how complex a case can get, and what you need to know foundationally to handle that, whether it's going to be you or referring it out, that's harder to navigate if you just go straight into it and don't have that background of working with so many specialists.
And I love that, Patricia. And I'll add to you, as someone who's had it both sides, both working with my dad, and I did a multiple year GPR. So what's interesting is there were skills that I did my dad didn't do, like place implants, and he was happy to refer them to me. And there were skills we did together. But what he was really helpful with was mentoring me with the patient experience. I would sometimes get too down if I had something not go so well. And he'd say that's how patients are. And I think that's what's really hard to explain to new dentists and dental students is that these more seasoned dentists, you can walk out of your operatory and say, this patient's doing X, Y, and Z, and say, I've seen it before. Go tell them this, or I'll go and help you. And I think that's really so important that it's not just the clinical, but also the communication part. Now, tell me a little bit about your journey finding jobs after dental school. You've been out for a few years. I know you've been working with Mitchell, but any other experiences? And, it doesn't have to be negative. Just if you're just telling me about your journey through the dental world.
Yeah. My first job out, I found through a different Facebook group, and did visit in person, and it worked out for a little bit, and then things started getting kind of not exactly what I had in mind.
Tell us more about that in the most evergreen way or hypocritical. So, and this is tough, right? Any relationship could be this way. It could be romantic relationships, it could be friendships, it could be coaching relationships. It starts out okayish and then goes into a direction that's not productive or positive for you. What does that mean to you?
It not going the way that
yeah, like when you said, hey, it started out okay, but then it's not a place I wanted to continue working at in the most kind of generic way. Was it the team culture, not getting the right materials, being asked to work too much, not getting paid? Because there's so many new dentists and dental students who will see that and they'll say, I've had relationships that haven't gone well, but in the dental world, what does that mean?
Yeah, I mean, and I see a lot of different cases that are, even more so than what I experienced, but being promised one thing and then maybe not having it fulfilled, like having a daily minimum, but having that day canceled because there's not enough patients, or, not doing the kind of dentistry I wanted to do either. And I wanted to be doing more and wanted more mentorship as well. And the dentist just wasn't there.
I hear that. Yeah. I hear that a lot. And I think that's something that everybody in the dental world should be cognizant of, is that our newest colleagues, it's normal to need people to help you, right? And it's not about doing 47 crowns and not needing help. And then also, I think I've just called it is, if you don't get paid right, it doesn't feel good, right, Patrice? You're not paid right at a job.
Especially in New York City.
Yeah. So, I mean, whether it's the job as a camp counselor so you got to say, if you're not being paid right, it's never a good feeling. And I think that is just a fundamental part of a successful job, is a clear, easy to understand way you're going to be paid there. Because I've seen the more complex it is to try to pay someone, the worse it's going to work out later. So what would you tell some job seekers looking for a job in 2024? They're going to finish their residency or dental school. They say, Dr. Patrice, I want help from you. What would you tell them?
I would say, check out different kinds of offices and see what kind of practice you may want to be in, whether that is you really love to be busy and be in a, PPO practice, or if you want to be more fee for service and focus on more so one patient at a time and really kind of diving into things there, because it is different environments. Or maybe you do a little bit of both to figure out what you want to be doing. Also,
I think it's awesome advice.
Same thing we talked about before, visiting in person, even more than once, because just one time you're not getting a true feel for it. When I met Dr. Rubinstein, it was like a year ago, we went to a CE course together, and we went to dinner, and I went to his office, and I went to his office again. Like, it wasn't just one meeting to determine that it would be a good fit. So I would say, if you really want to make sure it's going to be a long-term job that works out for you, meet a few times.
Love that. That couldn't be reinforced more, because I did a good video once where it's like, do you want to walk in to where you work, right? Do you want to get out of your car, get out of your Uber, get off the subway, get off the train, and do you want to walk into the building where you work? And that doesn't mean it could be dentistry or another profession, and there's no amount of money that can make up for a feeling of not wanting to walk into where you want to work. Well, I love that. Now, I think of Mitchell as a mentor to me. He has given me Patrick Winston How to Speak, which has helped me so much. And then I have seen so many compliments about this. So I want to just, and I'm not going to take too much more of your time because I know it's getting late, but it's just important. I just am so impressed by this. So Mitchell, you got all these patients who've never seen another dentist. And now Patrice, you have this office that you like, but you got to start working and nobody knows you, right? I mean, it's not easy. So Mitchell, you wrote this amazing announcement and you have Patrice's picture here. I mean, this is just truly gold. Tell us a little bit about what motivated you to do this, Mitchell, and how the impact was on your patients.
What motivated me mostly was one thing was thinking about how my father brought me into the practice. When he suffered the same thing, nobody wanted to see the kid, which was me. And he had to sell me, and it wasn't just a snow job. He really meant the things that he said about me. In the case of Patrice, I also was listening to other stories of people who had had some struggles initially getting their patients to accept their associate. And so I wanted to be real proactive about it. I didn't want to say, well, come on in and meet some people and do you. I wanted to, what happens in my practice is designed by me to be best for the patients. And I needed to sell this to them saying, this is what is best for the practice and what's best for you. You're going to love her. So here, meet Dr. Surdy. I sold it, and it wasn't false. It was because, I really thought so highly of her and I was excited to bring her into my practice. And so I sold it to people,
And I want to share the best line here. And what I say, if this helps anyone, whether you're a practice owner looking to hire an associate or an associate dentist getting mistrusted, the practice owner must look at the patient after they have said to a patient on a hygiene exam, my associate, Dr. Patrice, the dentist I work with, you don't have to say that my associate, dentist that's partnering with me, the dentist that's working with us, we're going to schedule this crown with Dr. Patrice. And they say, I don't want to see Dr. Patrice. I want to see you. But they get all worked up. You have to look at them and just say, I would be happy to have Dr. Patrice do this in my mouth and point to the same tooth. And you said gold here, Mitchell. You said, I'm excited to begin working with Dr. Surdy. In fact, after getting to know her, I was so impressed, I decided to ask her to be my dentist as well. And that's the true mic drop, because your patients cannot say anything if you say, this is the person working in my mouth. So Millie and Bob and Bill and Joe, you got to move past it and give her a chance.
After my dad retired, I kind of drifted from one friend to another, taking care of my, and I may be a little bit overdue, but that's genuine also, and I think it does help. And the rest is up to her in a way, but I got to get the patient into her chair. People have been resistant, some more than others. It hasn't really been tough to get patients onto her schedule. But the thing that I've noticed, which I'm happy about, is what I was wondering is, would there be any trouble getting them to have a second visit with her? And the answer is no.
That's awesome.
Once they've seen her, that's fine. That to me says it's all fine. It's just I got to help give a push over that first hump of getting them, familiar with seeing somebody else. People think weird things also. Sometimes they feel like resisting it is almost like expressing their loyalty to me.
Yes. Yeah.
And I got to get them over that too, and tell them, look, you have that much faith in my judgment. Have faith in my judgment now, and in the people that I bring. We're surrounded by. I have a hygienist that my patients love, but I take great pains to bring people into the practice who will take care of people, and they've given me, they've placed some faith.
I go to the Patrice for my beard trim and haircut now. My person, I went to associate Raya, and I love seeing her. Now I always just say you're going to be lucky. You're going to have two dentists who can help you, right? You're getting lucky. Now, before I ask you about this letter, Patrice, we did get two questions that are good, and we'll just kind of do a speed question. Someone asked, and it's such a good question, what advice do you have to find a good mentor for a new graduate? So I'll ask you, Patrice, what advice, if someone says, I need to find a good mentor, I feel lost out there, what advice would you give them?
Well, initially, I even, looked into getting this job with Dr. Rubinstein because I saw how much he would comment or post on different Facebook posts on the Nacho world giving advice. And I'm like, he seems like he would be a great mentor. Pay attention to those people who are looking to help others because they probably want to help you too.
I absolutely love that. And hey, look at that. Mitchell posting on a free Facebook group for years, sharing your awesome knowledge.
It helped me.
Up helping you get that trust factor. And one of my inspirations for Dentist Job Connect, I want to actually share this, came from a young dentist. And I love what she had DM'd me. She said, we had done this as part of Dental Nachos for a while, but it wasn't its own separate company. And she said, what I just thought was the coolest thing. She said, hey, Paul, do you have any dentists on Dental Nachos looking to hire associates? Because I figure if they're on Dental Nachos, at least they're pretty nice and they'd be nice to work for. And I just thought that was such a cool thing to have said. And then, so how about mentorship for you? My answer for mentorship is go to as many in-person C courses in the area you want to work as possible. Don't care if it's about pharmacology. Don't care if it's about even rememorizing the Krebs cycle. It's great, but go there and sit next to dentists and talk to them. That is my recommendation. How about yours?
Me? Yeah, basically you want to go places that the kind of dentist you want to look for people who you want to be like. You who you aspire to be more like, and then you kind of go where they go and hang out and talk to them. CE programs are where most dentists who are interested in continuous improvement and things like that will hang out. And in the area where you want to work, yeah, you just start talking to people, and it's hard. I'm not naturally that kind of person that just goes up and says, "Hey, I'm Mitch Rubinstein." How but you got to make yourself do it because you have to meet people, you have to make connections. That's the way you find people. I will say also that I want to thank Patrice for giving me more time now to post more stuff on Facebook. So I'm gonna, so I appreciate.
Thanks, Patrice. We appreciate it.
Thank you very much.
Patrice, this will be kind of our last segment part. This letter, how has that helped you on your end? Because, it's totally normal. You're going to this practice. The dentist has been the same for many years. You're seeing these people, but then you see your letter with your picture and Dr. Rubinstein saying you're his dentist. And I think he's such a cool and emotionally secure dentist that he says at the end, don't be surprised when we start answering the phone, Studio 57 Dental. So now he's like, using his words to put you on the team. So how has this helped you with some of the trust factor with patients?
Honestly, just makes me feel valued in the practice. And one of the things he did even beyond this letter was putting my name next to the door so that when people walk in, like I'm official there. I'm not just someone kind of floating through. And I think it gives them that confidence that, I'm there for the long haul to take care of them.
I absolutely love that. Tell us on your end, using Dentist Job Connect or finding Mitchell through it, how had the Dentist Job Connect program helped you find out about positions you might not have known about before? Was it easy to navigate? Was it, fairly simple to use the platform? Any feedback we could get would help us.
I found it pretty simple because I just kind of narrowed it down to the region I was looking for and then saw the details that were posted and went from there. I think it was pretty easy to communicate with Dr. Rubinstein, and yeah, I think it all worked out very well.
And then, and thanks, Patricia, on your end, Mitchell, you had your position posted, and since you are the dentist from New York City, it is very common that gets a lot of attention. We had another one recently, got 13 applicants in a short time. So how is the platform for you on the practice owner end of Dentist Job Connect?
Well, I mean, I see it as getting, a group of people for me to start doing there's still a lot of work for me to do, but very quickly was at least 15, maybe within a week or two. I had a bunch of people. I talked to a lot of people on the phone. I had a half a dozen people come into my office. Patrice was a standout the first time I met her, but I still had other people to meet. And so I kind of back, but she stayed pretty close to the top of the pack. And I did have a couple of other people back for maybe a second visit, but it was good to have a bunch of people. There were some that were clearly not right for the practice. There were some I think probably thought that I wasn't right for them either. And maybe half, which is fine also. Everybody isn't everybody's cup of tea. But it wasn't just a set of skills. I was looking for a certain personality type. I was looking for somebody who was, very, creative and inspired to learn more about dentistry, but also warm, and somebody who could, project that kind of, warmth that make people feel like they're being cared for, because they don't always know, how great our crown margin is, but they know if they feel like we care for them. And Patrice gave that off. And it was one of the major reasons that I wanted to bring her in my practice. So But to your original point, having a lot of people to choose from, that was spectacular. And it was way more people than I thought were gonna respond to
And
my
it
ad.
gives you, I appreciate it, gives you context. And what Patrice shared with advice, it's the same for practice owners. Observe at different offices to see what you want and don't want. For practice owners, sometimes dentists can be narrow-minded, and I'll say, oh, you should use Job Connect. And they go, my cousin's sister's friend's a fourth year in dental student, so I'm just going to hire her. And I said, there's no problem with your cousin's sister's friend, but why don't you get as many options as possible to either have that one family connection rise to the top and say, oh, for sure, or you may have to realize that there could be a better fit for what I will share is the most important position in your dental practice. So it's not something that you want to take lightly. And I think more options, the better. And we have this team behind us. You know this team from Mary, Amanda, Serena, Kate, Morgan, and Gu, and they work so hard, Mitchell. So maybe people don't know whether it's Nachos or Job Connect. It's not just me running around with a cell phone all the time, right? There's real people behind this whole thing making it happen. Tell our audience about your
A lot
experience
of
with my
people.
team.
I've met, well, everybody almost, either at a Nacho's event or at a CE program, whether I'm teaching something or whether I'm just coming to attend and learn stuff. I mean, they've all been, a presence there. There's a lot of stuff that goes on behind the scenes that is interesting to see in person. And I mean, each and every one of them have their, level of responsibility for that.
And one thing, if maybe we can teach this audience, and some here are our age, some are younger, and it's something my mom helped me with is, be nice and cool to everybody. And I wouldn't accept a patient who was not kind to my front desk team member, no matter what they were going to pay my office. And it goes the same way in our end. So dental students, dentists, whether it's the equipment reps, whether it's team members, people are connected to people who can change your life. So it costs nothing to be kind, and just make sure that you are a person who people say, I was really glad I met that person. And then Mitchell knows that goes a long way in this world and dental world.
I think it does. It does, at least from my perspective, when I'm meeting somebody, if that's the kind of vibe they're giving off, I mean, that's somebody I want to spend more time with. That's somebody I want to listen to, learn stuff from. That tells me this is a person that, I should pay attention to.